Empowered Voices, Identifying Strategies for Retention of Historically Excluded and Marginalized Students in DPT Education. I'm Adane Durham, a first-year Doctor of Physical Therapy student, and I'm happy to present the work of our research team. The lack of racial and ethnic diversity in the healthcare workforce is critical. Cultural congruence between a provider and a patient improves health outcomes by increasing access to care, patient satisfaction, and patient-provider communication. Despite strong evidence for the importance of cultural congruence, physical therapy remains among the least racially diverse professions in healthcare. To achieve a representative workforce, enrolling and graduating increasingly diverse classes of PT students is imperative. However, students from historically excluded and marginalized populations experience increased time to graduation and increased academic difficulty that may threaten their academic persistence. The purpose of this study was to examine perceived supports and barriers to educational persistence among DPT students in the Midwest as a part of a larger study to identify strategies for retention of students from historically excluded and marginalized populations in rehabilitation education. An electronic 43-item survey was distributed to students in CAPTE-accredited DPT programs in the 12 Midwest states. We received responses from 186 students across 8 out of 12 states. Analyses included response frequencies and thematic coding. Overall, we compare responses among students who identify as being from historically excluded and marginalized populations and students who identify as white. Our results showed that there are barriers for students from historically excluded and marginalized populations that are strong enough to challenge persistence through DPT education. While some supports and barriers were universal to both groups, others were not. The historically excluded and marginalized students uniquely identified barriers of diminished educational self-efficacy and lack of sensitivity and inclusion. The strongest supports included increased inclusion and faculty sensitivity. These are stark differences compared to their white peers. The historically excluded and marginalized students also reported a higher frequency of perceived microaggressions from both faculty and peers. They additionally report discomfort with being subjected to tokenism, and they self-protect when they encounter DEI topics. In summary, we learned that students from historically excluded and marginalized populations identify individual student barriers that coincide with and may exceed academic factors. We recommend that DPT programs survey their students about these individual barriers, recognizing that needs and barriers may not be academic. However, DPT programs need to also recognize that voicing these barriers may not feel safe for those students who report insensitive behavior from faculty and experience and/or witness microaggressions from faculty and students. Thus, a first step in increasing the diversity of the PT pipeline may be cultivating a culture of safety and inclusion for students from historically excluded and marginalized populations.